Shall I start, sir?
Yeah, please.
Yeah. So, very good evening to all, and very warm welcome. I, Dr. Swati Mahajan, Professor of Community Medicine, MGM Medical College, Aurangabad, on the behalf of MGM University of Health Sciences, I welcome you all. So, I welcome all the authorities and dignitaries of MGM IHS and all the units of the MGM University of Health Sciences from both the campuses, that is MGM Medical College Aurangabad and Navi Mumbai, School of Physiotherapy, Navi Mumbai and Aurangabad, MGM School of Biomedical Sciences, Navi Mumbai and Aurangabad, New Bombay College of Nursing, Navi Mumbai, and University Department of Prosthetics and Orthotics. So all the faculties from all these units, I welcome you for this webinar on exploring the research grants. So we were very enthusiastically waiting for this particular webinar. And a very special welcome to our guest speaker for today, Dr. Sanjay Zodpe, sir, who is Director of Public Health Foundation of India. Thank you, sir, for being with us for this webinar, and thank you for accepting our request. So as all are aware, MGM IHS is undergoing second cycle of a NAC. So all the faculty from both the campuses, we have been working hard on preparation of a self-study report, and all of us know like how it is important, the criterion 3 to achieve the higher grades. So criterion 3, that is research, innovations and extension. So this is very important criterion which differentiates from A grade to achieving A++. So it's the excellence in research which helps to achieve the higher grades. And amongst these very important metrics is how much research grants have been generated by the university from different government and non-governmental agency. So keeping this in view, today's seminar has been organized. So today we are really very, very fortunate to have Dr. Sanjay Zodpe sir here. I just would be happy to share one thing with all of you. So recently, the analysis of worldwide ranking of scientists in science field, this was done. This was conducted by a team of Stanford University, California. So, and they published author database in PLOS Biology in October 2020. So this ranking included top 2% scientists of the world, and so it's I feel very, very happy to share that Dr. Sanjay Zodpe is one scientist in these 2% top scientists in the world. So he has been ranked for his work in the tropical medicine. So we can know how his work is there in the field of research. So again, I heartily welcome you all. So to begin with, we'll have opening remarks by our Honorable Vice Chancellor, Dr. Shashank Dalvi, sir. Then there will be introduction of our speaker. This will be followed by a presentation by Dr. Sanjay Zodpe, sir, who will give a brief review of the process and different funding agencies. Then I'll have a brief presentation on government guidelines on this grant receiving projects. So because our Vice Chancellor, sir, he thought that all of us should be aware of these guidelines. Then this will be followed by a brief question and answer session. And finally, the concluding remarks will be given by our Vice Chancellor, sir. So I welcome you all and I request Honorable Vice Chancellor Dr. Shashank Dalvi sir to give the opening remarks.
So, good afternoon, good evening to all. Now, this is the time that has been, after finishing the work, we have kept this time particularly for this very, very important topic. Dr. Sanjay Jodpe sir, Vice President of Academics, Public Health Foundation of India, and Director, Institute of Public Health, eminent speaker for today's webinar on exploring research grants. Dr. P.M. Jadhav sir, our Vice President of MGM Trust, Dr. Sudhir Kadam sir, Medical Director and former Vice Chancellor, Dr. Nitin Kadam sir, Pro Vice Chancellor, Dr. Savitaram Madam, Director Research, Dr. Ajit Shroff, Medical Director, Dr. Swati Mahajan, who is also the moderator for this particular webinar and research cell in charge for Aurangabad campus and Professor of Preventive Social Medicine. Here I will like to share one thing. We all are, most of them are PSM faculty. So one common thread among all is the PSM or the community medicine. All the heads of the constituent units, Dr. Narshetty sir, Dean, MGM Medical College, Navi Mumbai, Dr. Bora, Dean, MGM Medical College, Aurangabad, Dr. Salgotra, Medical Superintendent, Dr. Raghavan, Medical Superintendent at Mumbai and Aurangabad campus, Dr. Suryavanshi, Deputy Dean at Aurangabad campus, Dr. Dase, Dr. Rajni Muller Patan, Dr. Wrinkle, Dr. Prabha Dasila, Dr. Uttara Deshmukh, Dr. Goyal, Dr. Parinita Samant, Dr. Goyal Registrar, he is also from Community Medicine, Dr. Parinita Samant, Dr. Rita Khadkekar, our IQC in charge, Dr. Raman Yadav, all the professors, faculty members, and most important for today's webinar, we have concentrated on all the PhD students who have recently joined and also who are doing the PhD, the scholars, the PhD aspirants, and the postgraduate students for whom this webinar is intended to be. I am very happy, as in the initial introduction, Dr. Swati Mahajan sir, madam mentioned that Dr. Jodpe sir, a national figure who ranked among top 100 scientist list of India and 2% of the world, that he is the eminent speaker to guide on this important topic of exploring research grant. We are also very fortunate, sir, that you are our academic council member also. PhD, as such, students are commonly considered as a stepping stone towards the research career. And those students who want to do this research career very seriously, they should do it right from beginning, right from selection of topic. Even for the postgraduate students who are inclined to do their career in the research, they are also having the various good opportunities. And while doing the research, as you are in the student career, one end, so the grant is always a limiting problem. Grants at MGMIHS is also providing the research grants, intramural research grants. Those are particularly in the form of kinds, that is we are giving the concessions in case of the investigations. Those are being done for the various research when your topic is approved by SAC and everything. Also the concession in the fees for the patients. So these types of grants we are providing to our research studies and the students who are doing for the post-graduation or the PhD. But many times this is very limited. And extramural research grants, those are to be always tackled. But the students are very much apprehensive whether I will get this or not, what I should do, how we should proceed for this particular type for the application for the extramural research grant and all that. Our institute, as you all know, it is NAAC A-grade institute and going in the phase of re-accreditation. Even in NIRF ranking also it is 100 to 150 in 900 university, total 900 universities in India. So among those, it is among 100 to 150 and 150 to 200 in 1400 overall higher education institutes in our country. Our hospitals, both the medical college hospitals are NABH accredited hospitals. Medical college hospitals, NABH accreditation is somewhat rare entity. Not more than 30 hospitals throughout the countries of the medical colleges, those are accredited for NABH. Our laboratories at both the campuses are NABL accredited laboratories and re-accredited also. Recently, our laboratories are zero-recognized also, all the laboratories. The ethical committees are DCGI registered and approved. At Aurangabad, Department of Pharmacology is approved as a pharmacovigilance center. You might be thinking that why I am telling this. Because when you are applying to any funding organization, maybe DBT, Department of Biotechnology, maybe CSIR, Council of Scientific and Industrial Research, maybe ICMR, Indian Council of Medical Research, Department of Science and Technology, Science and Engineering Research Board, Indian Institute of Science, and so on. Then these things will matter. Whether you are working with, what is the status of their laboratories, the facilities, the infrastructure, whether that is accredited or not. All these things are there and these are available with you and you should explore this particular opportunity. Since last few years, we are trying to see that each subject, each department of our university, 34 departments overall at the end of 2019. So they should set up the priority areas for the research. And they have set up the priority areas of the research. And among those priority areas, or even you can think which may not be in the departmental priority areas, a priority area, what you think, but your research should be of some public health use. Need-based research, that is also one of the important things that you have to do. The planning of your research study is the most crucial part. If you are planning it right perfectly, the design of your project is correct, then for funding, you can explore the various organizations. Interdisciplinary research, fortunately, ours is the Health Science Institute. Among the various units, we can collaborate and have the research. At both the campuses, engineering colleges are there. They can also collaborate with the engineering colleges also for the interdisciplinary research. The dental college is also at Mumbai. So the collaboration with dental college for carrying out the research, that can be also done. Even startup previously it is being considered only the domain of the engineering discipline, but it is not so. Even for the health science institutes, also the startups that can be done. I will not take much time because I am sure that we are very much eager to hear Dr. Jodhpe sir. So I again suggest Dr. Swati Mahajan, you can take over and invite Dr. Jodhpe sir.
So again, a very good afternoon to all those who have joined later. So it's a privilege for me to introduce the eminent scientist, Professor Dr. Sanjay Jodhpe sir. Sir, are you able to see the screen?
Yes, we can see.
Okay. So at the present, currently, Zodpe sir is Vice President Academics of Public Health Foundation of India, New Delhi, and he is also the Director of Indian Institute of Public Health, New Delhi. He is also President of Indian Association of Preventive and Social Medicine. So as said before, he is a medicine. Earlier, he served as Professor of Community Medicine and Vice Dean at Government Medical College, Nagpur, and Director of Indian Institute of Public Health at Gandhinagar and Bhubaneswar. He also holds a joint appointment as Adjunct Professor at Georgia Southern University, Georgia, of North Carolina at Chapel Hill, USA, the University of Sydney, Australia, and Deakin University, Melbourne, Australia. Earlier, he served as Member Institute of Medicine, Global Forum on Innovation in Health uh, Professional Education, Washington, D.C. He was former chair, Global Evaluation and Monitoring Network for Health. He was a board of member, Routine Health Information Network, Boston, USA. Earlier, he served as country lead for Asia Pacific Network on Health Professional Education Reforms and country focal point for Asia Pacific Action Alliance for Resources for Health, that is AAAH. He is engaged in several major national and international research initiatives. And to his credit, there are 385 research publications. So his current professional interests are global health, health system research, maternal and child health, vaccines, workforce development, and education of health professionals. So here we have an eminent scientist, a great academician, and a great public health expert from India. So I again welcome you, Professor Sanjay Zodpe, sir. So I request him to do the proceedings.
Thank you, Swati. I think you'll have to stop your screen.
Yeah, yes, sir. Yes, sir, I stop.
Are you able to see my screen, Dr. Swati?
Yes, sir.
Thank you. Thank you so much for this generous introduction, Dr. Swati, and distinguished leadership of the MGM University, Honorable Vice Chancellor Professor Darvi, and the deans and head of the departments and management leadership of the MGM University. Dr. Swati Mahajan is a colleague from Community Medicine Department, distinguished faculty, and I'm told that PhD students also have joined, so PhD students. And ladies and gentlemen, at the outset, let me express my gratitude for inviting me to share some of my thoughts in the context of research grants writing with all of you. This particular area of professional engagement has been very close to my heart, and being even in academics also, when I earlier served in a medical college and subsequently now works with Public Health Foundation of India for last 13 years or so, I purposefully and significantly has engaged myself into a variety of the research grants, and particularly the organization that currently I work is a research-driven organization. And therefore, this is very critical and important for our organization. And therefore, what I thought is that I will share with you, in the context of grants writing, my own personal experience, because you would refer to textbooks, and even in a lot of these days on internet also, you would find a lot of information is available in the context of grants writing, and what are the issues related to the grants writing. But what I personally felt is that I should share with you my own experience of grants writing, and then how it is important in advancing your professional career, and what are the bottlenecks, barriers, challenges, facilitators that we all encounter when we really talk about the grants writing. And so far, I have been involved and engaged into more than 200 projects from the beginning of my career, and several of them in recent past as a part of my Public Health Foundation of India stint and engagement. But of these projects, several of them are research projects, but we also have capacity building projects, technical assistance projects, program development, and at times some capacity building in the context of short-term training and workshops. And these are all funded by some agencies. And also had an opportunity in my professional career for being a reviewer of the grant proposals. I sit on several government committees and some international organizations to review the grant proposals for disbursement of the grants. And we have been conducting grants writing workshops to teach our young professionals to how to write grants, how to procure funding, and then do write good research papers. So this is what is the experience that I thought that probably through this maybe 45 minutes, 50 interaction that would like to share with you. And of course, when you are engaged in writing grants, procuring funding, doing a good research, you will generally be able to produce very good quality research publications, because that is the output of the work we do by procuring grants. And that experience also goes in hand with the grants writing is concerned. Let me at the outset tell you that getting funding is, of course, a challenge, a difficult at times. But I would also like to tell you that there is a huge amount of funding sources available both within the country and outside the country. And if you look at grant seeking, if as a business, it's a multi-billion-dollar business every year. You would find that huge amount of money is disbursed by a variety of organizations, and that which are these organizations which give you money. You would have put them together as a single company, then it would have ranked at the top of the Fortune 500 list. The point I'm making is that at times, this is a very common complaint that I have heard from our own colleagues, is that where are the resources, from where to get the money? But I would like to tell that resources are available. The question is that, do we have the good proposal? Do we have access to that money? Do you know from where to get that money? And therefore, another example that I wanted to mention is that if you visit the grants database that identifies approximately more than 10,000 public programs, which would disperse a huge amount of grants. So the first point that I wanted to make is, from the perspective of grant marketplace, there is opportunity and there are resources available. What we need is good quality proposal and matching with the donors' expectations. That is what is important. Another important point I wanted to mention is that generally, and today also we will deliberate mostly on securing funding for doing research. But I would like to tell you that the funding is available for variety of the activities in academics and professional field. So it is not only the research projects that you would get the money, but there are many activities, and each one of these activities, personally, I have been able to procure the funding. And therefore, I wanted to mention that there are two slides here basically where the funding could be available. We all know that, and today also we will focus on research projects. That research projects could be a single site project, like you are doing some case control study in your hospital and looking for the funding, or it could be a clinical trial being carried out in 4 institutions within the India, or you have multi-country, multi-site studies also for which the funding is available. The next important activity for funding is available is implementation projects. In the context of the health systems, if you are implementing something in collaboration with the government, and operations research falls mostly in the domain of these implementation projects, the funding is available. Technical assistance also, if you are supporting some initiative and for which you are looking for resources, then technical assistance is available. I would give an example of technical assistance. Currently, we have a huge uh, Bill and Melinda Gates Foundation grant, and I am the PI of this project. It's an Adarsh project where we are supporting 9 states in India in rolling out some critical component of the national health policy. You would be remembering that the national health policy has been released in 2017, and there are several of activities listed as a part of national health policy. One of the activity is related to strengthening postgraduate medical education in India, and how can we use district hospitals as the model centers for implementing some postgraduate programs like DNB and CPS and other programs. And we are helping 9 states in and providing the technical assistance in rolling out this particular aspect of the national health policy, for which the Bill and Melinda Gates Foundation has provided a very huge, substantial funding for undertaking this activity. Example of implementation project is that we worked with Delhi government, and like we have the model of ASHA. There you must have heard that we have these ASHA working as a part of our health systems. They have developed we have developed a model of urban health worker like ASHA working in the urban dispensaries and urban health system in the Delhi government, and that was the implementation project which was supported by the WHO headquarters in Geneva. Program development. Suppose you wanted to develop some program, it could be a tailor-made, suppose, a leadership program. That I would give an example of these. We developed a leadership program for South Asian policymakers, and we got the funding from the AusAid from Australia in collaboration with the Melbourne University, that we worked to develop this particular program. Some of the e-learning stuff that is being currently, in fact, we are developing IYCN, MIYCN program for the professionals working in the space of community medicine, OBGYN, and pediatrics, and that is supported by Alive and Thrive through IP Global. So again, a program development. Lot of program evaluation activities of the various national programs. So it could be a very small component of the program is also supported and funding is available. Capacity building, trainings, and some of the PhD students are here. Even for them, for higher education, the fellowship programs are available. I will give you an example of capacity building. At Public Health Foundation of India, we had 2 important capacity building initiatives. The first one was a future faculty program through which we selected young to mid-career 40 young professionals in India and send them to best of the universities globally, including Cambridge and Oxford and London School and Sydney University and Melbourne University. So, and get them trained and to work as faculty with us. And the whole initiative was supported from the grant. And the Wellcome Trust funding was available, where we had identified 11 UK institutions. We collaborated with them, and then we trained 27 PhDs, almost, I think, 16 masters, and several visiting faculty and other initiatives in the context of the capacity building grant that we obtained from Wellcome Trust. Exploratory developmental grants, grant writing support, building collaborations. GemNet Health is one of the global initiative where I had an opportunity to chair also for 2 years, where we provide, in the context of monitoring and evaluation, if 2 or 3 institutions globally in working in different continents, if they wanted to come together to design and develop impact evaluation proposal, like for example, University of Ghana, then INSP Mexico, and our institutions in India. So these 3 institutions, so 3 researchers from these 3 institutions wanted to develop an impact evaluation proposal, which could be implemented in some 6 countries globally. And for writing the grant itself, The funding was available, and through this GemNet Health, we support these initiatives. Then fellowship programs are there like postdocs and scholarships, and several of them through CSR funding also, like, and even consulting firms like McKinsey is a consulting firm which has been supporting scholarships. Infosys Foundation is supporting scholarships. So there are Tata Trust supports scholarships. Then institutional development and strengthening, you can write proposals for development of your institution and strengthening, and like Department of Science and Technology, Department of Biotechnology, they provide some initiative. The FIST is one of the program, like funds for infrastructure development and strengthening, where the money could be made available. Then suppose you wanted to create a center, you wanted to, like suppose you have a WHO collaborating center being established in your institution, and you need to look for resources to create that center or some laboratory. Even equipments like DBT, DST support some of the equipments which have relevance in the context of the research. I tell you that even running a secretariat, that I was involved, and we got two important fundings. One was from WHO Sierra region, and another was from the Rhino is a global organization in routine health information network. They supported us some funding to run a secretariat for strengthening routine health information systems in Southeast Asian region. Advocacy, like for example, you wanted to do advocacy for a public health cadre, and then a lot of work is to be done. You need to travel to the states, you have to engage with the states health secretaries, and for that the funding was being made available, and we use resources for that purpose. Documentation, reviews and reports. Recently, I think last week only, we published one paper. It was related to the systematic review of obstetric fistula in South Asian context, which was supported. That was a review, that was a systematic review that we had carried out, which was supported by WHO CRO region. And why am I giving an example is that we should realize that every activity can be supported. It's not that I'm just mentioning these activities. I can give you some examples from where we got this money. Consultations, meetings, seminars, we all know that, even conferences, workshop, scientific sessions, that you can get resources to do. Academic visits, as a Wellcome Trust initiative, we had inbuilt component of academic visits, that our faculty visiting to some good universities in UK, and the funding was made available for those purposes. Of course, there has to be a very specific proposal to the faculty visit. Like we wanted to develop e-learning programs at Public Health Foundation of India. We took our 5 faculty members and 3 program staff to London School, and London School of Hygiene and Tropical Medicine. They have a very good e-learning network and setup. And the days when nowadays it's become a digital use of e-learning very common, but it's almost more than 10 years back, when the learning management systems were not that critically used. We built our capacity of the people. Even we took them, one group of individuals, to the University of Sydney to look at what kind of programs are being conducted by that university, what kind of platforms are being used for that purposes. Even visiting scholars and internships, money could available. Writing manuscripts and books and policy briefs, the resources could be made available. Travel grants is one of the Tata Trust supports travel grants, but there are many other agencies also support travel grants. Then consultancies, individual and institutional, and many development partners, bilateral agencies, they are keen to support some specific aspects that they wanted to hire your expertise. What you need, of course, is that anybody would give you money for your own expertise and standing. And therefore, you need to have those hip pocket competencies that you can say that, yes, this is something which I can do. And then the people would approach to you. Then specific aspects of the big project, like there are some multi-country clinical trials are going on, and they wanted to establish one center where you can undertake a data management or statistical analysis for them, or quality assurance measures for them. Then incubation centers like small business technology transfer grants are available, and even grants for scaling up innovations. Like some smaller NGOs had done some innovations which are effective, and which needs to be looked at from the scale up purpose. So resources could be made available for scaling up these innovations. So these are the variety of the grants that are available, and one can look at for these grants when you wanted to build your professional career. But today we'll more focus on the research grants. $1 million question that comes to our mind is that, and we as researchers, professionals, and faculty working in medical schools and nursing schools and other professional institutions, is that how do I improve my odds in procuring funding for research? And for seeking research grants, you have to improve your odds. Some of us are able to procure grants. Some of us are not able to procure grants. So what is that distinction, or what is that distinguishing features that you think are critical and important for procuring funding? I would actually focus on some of those initiatives. Relevance is important. Science is sterile if it lacks the social relevance. Policies would crumble on clay feet if they are not firmly placed on a pedestal of valid science. Your proposal needs to be relevant. You write something which, and we will also talk today about what are the steps or what are the issues involved in writing proposal, scientific proposal for funding purposes. But your proposal is not relevant. Who would fund that proposal? Relevance is the most important. The next is implications, that your proposal should have outlined implications. What is the utility of the finding that you are proposing to generate through a particular proposal? Because we all recognize research is merely a tool. What ultimately benefits to the society is the knowledge. And knowledge has two integral parts. One is knowledge generation and knowledge translation. Research helps us to generate the knowledge, but we also need to see that how do we translate this knowledge for the benefit of the society? Because this knowledge generation gives you the thrills of discovery, but knowledge translation would give you the satisfaction of the purpose being fulfilled. And therefore, implications for any research are important. Any proposal that will be reviewed from the funding agency's point of view, because as I mentioned to you, I sit many of these committees where we review proposals. These are important issues. We look for implications. Are there any implications of this work? If it may be, you might find that this is a very interesting research question, but if it doesn't have implications, the probability that you would be able to get funding for that is limited. And of course, the scientific merit and feasibility. No proposal would be funded if it is scientifically weak. The methods are important. The design that you use, the sample size that you estimated, the various systematic and random errors that you might encounter into, what are the measurement issues involved into. So the scientifically, you need to have a proposal which is well designed. And of course, it should be feasible also. You're proposing something which is not doable, then the donor agency don't want to waste their resources. And of course, I understand that at the beginning, you do not have a strong research credentials. But over the period of time, we need to build our research credentials. If we are able to build our research credentials over the period of time, 5 years down the line, 10 years down the line, 15, 20 years down the line, that helps us strong. Because people may not know you. When they look at your proposal, they also look at additionally at your CV, at your research credentials. And looking at CV, if they see that you have enough competence to undertake this particular research, then that helps too. And therefore, building research credentials over a period of time is important. And that would also help you to create a track record, because you have to create a track record with even agency. Suppose you have been supported on by UNICEF on some small project that you did. Then if you do that project well, well in the sense that you have followed the protocol properly, timelines are followed, and you have been completely professional in doing that activity, and then the resources are appropriately spent, and all the documents and SOEs and everything is provided on time. So that's how you create your own signature. That's how you create your track record. And then the next time UNICEF wanted to do something, they would say, oh yeah, these are the good people. They do their task on time. They do it professionally, and they would come to you. Research capacity, of course, is very important. We all understand that without research capacity of undertaking, suppose you wanted to do a clinical trial, you need different capacity to conduct a clinical trial. If you wanted to do a mega project, implementation project, operations research, you do need that capacity. Now, suppose you are writing a proposal on mathematical modeling for now, for example, assessing the suppose the vaccine COVID-19 is introduced and what will be implications on that. But then do you have the capacity of that mathematical modeling? Suppose you are proposing something as a part of your proposal as a very advanced technique like multi-level hierarchical modeling. You have written that, but are you able to undertake that? Suppose you are suggesting a systematic review, a meta-analysis is to be carried out. But then people feel at times that meta-analysis means, you just collect the data from some 10, 20, 30, 40 studies together, which are available globally, and you sit in your office and you write the paper. But it's not that easy. You need to understand the nuances of conducting meta-analysis. Like, for example, the fixed effects models, random effects models, and there are many other issues involved into that. So when you are writing a proposal on the systematic review or a meta-analysis, do we have that capacity is important. Then the grants writing capacity is also needs to be looked at, because scientific writing itself is important, because I have seen people have good ideas, good thoughts in the head, but they are not able to put those coherently, those good ideas on the paper. Because you should be able to write, your writing skills are important, your communication skills are very important when you talk about the grants writing. One is communication skills, and secondly, the tactics of writing the grants. What are the issues that you should reflect on? How do you present your scientific arguments? How do you bring your research competence when you are writing that proposal? Is all about grants writing capacity, which also includes drafting budgets, then linkages with stakeholders, because we work in a space where we are confronted with problems which are multifactorial, and therefore the solutions are also multi-layered and multi-sectoral. You have to engage with the stakeholders. You need to work with the health systems at time, and you need to work with the governments or other hospitals or the other NGOs. So linkages with the stakeholders are important. Standing in the field and being a research leader is really one of the important issue that is looked at. Suppose you have been working for last 10 years in the area of pelvic inflammatory disease as a OBGY specialist, or you are working in the area of suppose cervical cancer, or you are working in the area of multi-drug resistance tuberculosis. So we create our own position, we create our own standing in a particular field, and you are recognized as a research leader. And therefore, if you are recognized as a research leader in either neonatal health or vaccines or health promotion or whatever area that you wanted to work, or some surgical interventions, and if you are writing a proposal, then the funding agency has a trust in you. They say that you have already a standing in this field and you will be supported with that. Then developing the field, actively publishing in a field is very relevant and important. You need to be focused. You cannot work in 20 odd areas. You need to identify few areas where you wanted to build your career and professional development, and actively continue to publish in that particular field. And as I mentioned earlier also, there is an argument on the part of our researchers that there are inadequate opportunities related to the funding. I tell you, I know personally more than 100 donors that we very closely work with, and their concern is exactly opposite. Their concern is that where research confidence? They say that we wanted to, get this work done, but who will do this work for us? So there is a paradox of, on one hand, we say that there are inadequate opportunities, but there is on another hand, the donor agencies, they have a thinking that there is a limited research competence and where are those people? And this disconnect needs to be resolved. And therefore, we need to have that research competence to identify appropriate opportunities is important. Then creating research team. None of us on our own can be expert in all the fields. Some of us may be good in writing. Some of us may be good in managing project. Some of us are, good at statistical issues involved in analysis purpose and other issues. Some of us may be very good in, we have clinical skills, and that is a part of, suppose, integral part of your project, then that is important. So finally, what is required is a team approach. Don't think that you alone would do everything. And building teams is important, because not everyone is good at all the things. So create teams which will help you to push the agenda further forward. Know-how is important. Grant, we were talking about this, that you should know how this grant seeking process works, because this is a business and you need to know the nitty gritty, the nuts and bolts of how it works basically. So that know-how of grant seeking process is also important, which improves your odds of procuring funding. Then sources of funding. I will deliberate today on variety of the sources that are available to us. Then research systems and processes. You want a proposal as a faculty in a medical school, but then the research systems and processes in your institution are important. Whether we have institutional ethics committee, institutional review board, suppose data safety and monitoring boards to be created at times. You have sufficient systems and processes. You have financial management systems. Your administration and leadership is supportive of that. Is also looked by the funding agency. And therefore, institutional research ecosystem and culture is important. That there are certain institutions which are research driven institutions or research driven universities. And if you reach that level that your institute or university is recognized as a research driven university, then the donor agencies also look up to you, that if you can take up that research, because finally that ecosystem needs to be built. You cannot work in isolation. You may be a great researcher, but if there is no institutional ecosystem, then there is a limited possibility that you can move forward. And therefore, research enabling environments, research driven institutions are important. Most of the research these days is a reflection of collaborations. Again, I wanted to re-emphasize that you alone may not be able to do that. I will give an example. Recently, we submitted a proposal, and I was leading this effort at our institution. And we wanted to undertake mathematical modeling in the context of this COVID-19 vaccine as an intervention, and work around that. We initially thought we will submit to the Department of Science and Technology. It's a quite a big funding, and as independently alone, proposal. But then we, partnered with IIT Mumbai and Indian Council of Medical Research, National Institute of Epidemiology in Chennai, and because there has to be a international counterpart, because there is a AUSAID, means the Australian government and Indian government, is a joint funding program. And so we collaborated with the University of Sydney. So now, working independently, and we thought, suppose we would have submitted proposal on our own. And now we have submitted the proposal where IIT Mumbai and ICMR and NI Chennai and Sydney University are collaborators. Definitely, I believe that there is a more possibility and probability that we would get through this funding. Establishing credibility with donors is important. You do 1, 2, 3 good projects with the donors, they will come to you. I tell you, these days, 50% of our projects at our institution are, like they come to us. We don't compete for that. We don't write even proposals. Of course, proposals are written later on, but they come up with the idea and they say that, we wanted to work in this particular area. This is our research question, and we wanted to answer this research question. Can you help us in this? And then we write a proposal, and then there is a back and forth between the donor agency and us, and then finally the funding comes through. So there's a sequence of the proposal, and I will give just 2 examples we are working with WHO on. One is human resources for health. I think in last 3 years, we got consecutively 4 grants. The last 3 years, I would say, three years consecutively 4 grants, 1 grant to another grant, another grant to another grant, to work in the area of human resources for health. Now, the latest one that we procured 2 months back is we are looking at the investment case. We are looking at the economics, the investment, building the investment case for the human resources for health for the government of India. Similarly, routine health information system, that is the RHIS. So in that context, again, we got 3rd grant last month or so. So consecutively 3 grants, establishing the credibility with the donors. You do good work with donor, 1 project, 2 projects, they will come to you for 3rd project, 4th project. You will have to tell them that we are busy. But that generally happens. Then operational issues, of course, like for example, you wanted to get funding from outside agencies, outside India, then you need those FCRA clearances and operational issues. So funding agencies, suppose outside India agency, European Commission wanted to support research at MGM universities. Obviously, then the question is that whether you can accept that funding by the law of the land here. for which you need FCRA clearance. So those operational issues are also there. Then if the projects are big, then do you have the capacity to handle mega projects? And this capacity is not something you would learn overnight. It is a continuous persistent efforts over a period of time that you build your capacity of handling mega projects. Mega projects means, like, for example, more than $5 million, $5 million, $10 million, $50 million, multiple sites that you are engaged into. Now, this Adarsh project that we are doing with support from the government, the Bill and Melinda Gates Foundation, is a mega project. We are involved in 9 states with DNB, CPS, then NSSRC is important stakeholder, the Government of India Ministry is involved into, and we are providing technical assistance. So these mega projects involves a lot of additional issues other than research, a lot of management issues, a lot of project management issues are relevant there. Then collateral funding. Suppose you have some agencies say that we would provide you 80%, like at times UNICEF demand this. They say that we will provide you, suppose the project cost is suppose 30 lakhs. Then they say that we will provide you 25 lakhs. And then 5 lakhs, maybe that if your institution or university can put it into. So maybe 10%, 15%. At times, this may not be actually in the costing, but it could be in the kind form that you are using the institutional laboratory or institutional facilities that are there, or you are using the time for which you are paid by your institution. So that's collateral funding. And then, of course, the transdisciplinary research is important. And Professor Darvi also mentioned in his initial remarks that you have different institutions, and these transdisciplinary approaches are required because our problems are multi-sectoral, multidisciplinary, and at times, therefore, we need multi-layered and multi-sectoral and multi-departmental approaches to solve our problems. That's important. And finally, the proposal that you develop, you have to sell it to the funding agency. And therefore, the art of salesmanship is important. That how to sell your proposal to a funding agency is, and this is a knack that you would learn over a period of time. And I would tell you that these are all boxes that you have to tick, to improve your odds. But it never happens overnight. Like, for example, establishing credibility with donors. It never happens that in 6 months you would establish a credibility. Or like, for example, institutional research ecosystem and culture. It never happens like today, you are not there and then tomorrow you are there. Or the know-how of the grant seeking process. It's a continuous efforts over a period of time. And then, you decide today that after 5 years, where do I want to stand myself as a professional and in the context of as a researcher, then you have to plan accordingly and you have to build on all these tick boxes basically. And therefore, each one of these boxes that you have to systematically, strategically, and consciously invest your time and talent so that you build on these boxes over a period of time. And then you become a professional where the donor agencies are after you. And they would say that we have money. Can you please help us, resolving this particular problem? We bring the resources. So the key proposals, the key issues in the context of grants writing are that, please remember, the good proposals are not developed overnight. You have to spend time. Don't create any shabbily, written proposals. Sometimes, as I mentioned, that I had an opportunity to be sitting on the other side of the table and reviewing many proposals of very good organizations, very big, good organizations, including Wellcome Trust and many other organizations. And, sometimes you pick up the proposal and even you just scan through a few pages, you realize that this proposal is so badly and so shabbily written that you don't intend to even read that proposal also. And some proposals, you just pick the proposal and you just start, lifting the pages, and that you would find that this is something is interesting. Good proposals needs that you need to invest time. Meticulous planning is important. You have to work around, you have to create the team, that these are the 3 people, 4 people who would be working. You can divide the sections that you would like to write. And as I mentioned to you, that each one of us can bring a competence in a different area. Then we all can contribute to that. And then finally putting those pieces together to see that the flow is there. Everything is coherently written. The flow is there. The articulation of the issues is there. The articulation of research ideas is well reflected. The methodology is appropriately reflected. So all that becomes a part of the meticulous planning. and think outside the box. Sometimes what happens is that we read something in some journal and then we think that we will replicate the same study in our hospital. Of course, replication of that study is, of course, could be relevant also. But unless you bring some innovation, something new, that because research is all about creating, it's not something which is already some 20 people have worked and had said that there are issues, then what is the additional value that you are going to bring to the proposal? Because when proposal will be looked at, it will be also looked at from the point of view of value addition to the knowledge. If it is not bringing any value addition to the knowledge, why somebody would be funding that? And of course, you should know the sources of funding. But sources of funding is one thing. I will enumerate some sources of funding. But the priority of funding agencies is also important, because there are certain agencies, they fund in a particular area. Now, Save the Children. Now, Save the Children is an organization which funds research in generally in neonatal health or under 5. The name itself is indicative of Save the Children. UNICEF initiatives, again, focusing on mostly on child health, some extent even maternal health also, because that has a relationship with the child health, but neonatal health, health of under 5 children, so those malnutrition, so those could be the areas where probably UNICEF would be interested. If you write a proposal on, unless it has connection with the child health, suppose tobacco or non-communicable diseases or diabetes, and UNICEF would say that it is an important problem, but that is not our priority. That is not our priority. There are certain organizations and funding agencies which support health systems research. So in the context of health systems like leadership and governance, or health financing, health service delivery, or human resources for health, or supply chain management, so they would only support in that area. If you have a disease specific proposal, like suppose you wanted to do some work related to obstetric fistula, and you go to them, they would say that this is interesting work, but we don't have a priority to support funding in this area. There are certain agencies, they support research in the context of health professional education only. We worked with some of the boards and some of the foundations which only say that they wanted to strengthen health professional education because it's mandate. Because every funding agency, they have their mandate, and they would support research aligning with their mandate. They will not support something is debating. Of course, sometimes you would find that they would walk to support some of the initiatives of interest. Like we were working very closely in health professional education. China Medical Board has supported, and China Medical Board, they support health professional education, but India is not in their list, and for obvious reasons. But one of the initiatives that we had a dialogue with them, and they said, no, this is very interesting, and despite the fact as a country India is not in their list, but still they have supported in collaboration with Harvard University of the research that we had done in that regard. The next important point is when you write a proposal, you need to develop a protocol. And for that, you can actually work in a workshop mode. It could be like initially a conceptualization of idea, then developing and putting things together, and then you finalize that. So it happens in a workshop mode. You have to dedicatedly work. See, development of research proposal is not the salad that you would keep on the corner of your main menu. It's a main menu. If you wanted to be a researcher, even if suppose when we work in medical schools, we are faculty, and our responsibilities include for clinicians, particularly we are providing clinical services, health services to the population. And then of course, teaching and training is important responsibility. Of course, we are involved in administration also, a lot of responsibilities from admissions to so many other things we are involved into. And research is also one of the activities. So these are the 4 areas that as a faculty in medical colleges that we are involved into. And then what happens is that because we have to take care of our OT and OPD and our ward rounds and everything, so we are busy. Secondly, then we have to teach also to undergraduate students, to postgraduate students. Then there are, because you are a professor or a senior faculty, some administrative responsibilities. And then by the way, we say that by the way, we will also do a research. Then that actually, doesn't help in a long way. So therefore, you need to have a very dedicated time for research activities. You should earmark the dedicated time. And therefore, when you are developing a proposal, you can say that these 3 days we will work together in a workshop mode and work around that development of the proposal that we do. Now, we have limited time today, so obviously I will not go through the details of the each aspect of the structure of a research proposal. But what I will do is that I think there are two slides where I would provide you the checklist. What should be there? By and large, of course, some of the issues may not be there because each donor agency would also have their own formats. They would also suggest you what kind of information should be reflected as a part of proposal. But this is an indicative information that when you write a proposal, please ensure that these aspects are covered into. And therefore, these two slides are the checklist for you when you write the proposal. Obviously, the title is important. Investigators and collaborators are important. Rational significance and background, that the background of the work, that what you wanted to propose, how it is significant, what is the biological rationale for that, how relevant it is important. That research question should end up with looking at the rational. Anybody who would read your background or rational section should be convinced, yes, this research should be carried out. Of course, research and institutions, credentials, CV is also important. And these days, when donor agencies look at not only the researchers' credentials, but they also look at the institution's credentials, that how many faculty are there, and they have some standard formats that the output in terms of publications or grants in last 5 years, or suppose DPT is supporting or DST is supporting, then do we have earlier grant with DST or DBT, something like that. So all that information needs to be filled up in the standard formats. If you have done some preliminary studies, that adds value. So mention of that is important. Then research question, objective and hypothesis is because your significance and rationale should culminate in posing a research question that you wanted to do, and what is the question that you wanted to ask as a part of the research that you have proposed. Literature review, very briefly, it may not be very exhaustive, but it should give the glimpse of that you have read the literature and you have an understanding of the issues surrounding the research question. That is what is required here. Methods are most important, because whatever brilliant research idea that you might have, but unless you have appropriate methods being used, then the you will not be able to answer question otherwise. Study design, whether the case control study, it's a clinical trial, it's a simple observational study, or it could be case studies, or it could be program evaluation, it could be economic evaluation, it could be systematic review. So what kind of design that you wanted to use? What is the setting where the study will be carried out? Then the selection criteria, sampling design, the variables. What are the outcome variables? What are the predictor variables? How do you measure those variables? And these are all simple things. Sometimes we feel that suppose the toxemia of pregnancy, and measurement of blood pressure is of course very important integral part of defining the outcome of that particular study. And you will say that what to mention about measuring of blood pressure is something which probably we all do as a routine, and so there is no need to explicitly clearly mention, but it is important, because the measurement of the blood pressure here, systolic and diastolic blood pressure, determines the outcome of your study, and there could be a possibility of misclassification, and therefore you need to deliberate on that. Sometimes we like, if any study related to suppose the birth weight of babies, if you wanted to study the predictors of low birth weight, and therefore the birth weight, how do you measure the birth weight, which scale will be used, how it will be measured, who will measure, what will be the accuracy and reliability issues in relationship to these are small things which are important. I was involved in one of the WHO study where CMC Vellore, and that time I was in Nagpur. We had done a clinical trial. It was a multi-country clinical trial carried out in 6 countries, and India we had 2 centers where we looked at the calcium supplementation in women for the prevention of the eclampsia, and in the context of particularly in the women with low calcium intake, dietary calcium intake. And as I mentioned, the blood pressure was an important instrument. All the study investigators, along with their research staff, were flown to Geneva. For 3 days, they ensured that each one of us measured the blood pressure the way it was expected, because that was the critical, and they were doing a multi-country study, so they wanted to have everybody on one page on the measurement issues. Tools, methods of data collection, what kind of methods that you wanted to use. Suppose you wanted to use a qualitative research, then focus group discussions, in-depth interviews, or whether you have a tool for quantitative techniques. statistical issues are important. Sometimes we feel as researchers, because several of us are medical professionals, health professionals, clinicians, and we may not be very thorough with the statistical issues. But I tell you, this is one of the areas that if you can build your competence, it will always help you in procuring funding, because then you will be able to defend it when suppose you wanted to go and present it to the donor agency, and if they ask you questions, you cannot always refer to the statistician. Of course you should consult statistician, but you should have a basic understanding of the sample size and power analysis, or what kind of an analysis plan is proposed, creating W tables. Some basic understanding, some basic fundamental understanding is useful. Training component, if the training is involved in some project, then that component, there has to be operational manual. Gantt chart and time frame is important. And we have seen a lot of proposals. People just say that the study will be accomplished in maybe 9 months, but they don't give the split up of 9 months, because the first month probably you would finalize the study tools, consent form, then take the institutional ethics committee clearance, then you will have recruitment of the staff, then actual data collection will start. So maybe 5 months the data collection is there, then data entry is there, then data analysis is there, then report writing is there. So if you prepare a Gantt chart, then that gives the confidence to the donor agency that you have thought through the process. That is relevant. Otherwise you say that I will do it in 9 months, but and then sometimes it also happens that if there are no time milestones are provided, then we have 9 months. So you may start working on the proposal, and then first 3 months, 4 months you are very slow, and then you think, in home and have hot time, and then by the time you are midway through, and then you realize that now your recruitment of cases getting delayed because you are dependent on the patients who are coming to your hospital, and so on. So time frames, Gantt charts are important. And any donor agency, this is one of the critical issue that when I encountered with many donor agencies, they feel when the proposal is written, people say that we will accomplish certain study in 6 months, 9 months, but then they don't do that, and that is their concern. But that's how we create our signature. We should be doing, it should be realistic also. If something cannot be done in 6 months, it cannot be done in 6 months. You say that it will take 8 months or 9 months or so. Be realistic. But for getting money, you say that I will accomplish everything in 6 months, and then when actually work starts, we are not able to do that. That's not good. Project management. Sometimes if it is a field-based activity, or even a hospital-based activity, you have some project being employed, and proper training of those people is important. Staffing is important. Assigning responsibilities are important. Because when you work in mega projects, you as a principal investigator, you cannot do everything. You should not be doing everything. Assignment of responsibilities is important. That's the principle of the teamwork. Otherwise, we create the team, but we want to do everything, alone, or as a PI, I am the responsible. Of course, we are as PI responsible and accountable also, but it doesn't mean that you should not delegate the responsibilities to the team members. Quality assurance is an integral part of any research. You should clearly mention in your proposal that how you handle the quality of the work that will be carried out. And quality assurance begins from writing of the proposal to the report writing, even data entry for that matter. Like, is it a double data entry? Or suppose the data is being collected, then supervisory visits and senior investigator or the consultant checking those data that is being randomly, suppose randomly you pick up 5 tools and then re-examine and re-verify those, whether the data has been appropriately collated and collected or not. All these are important. When you are involved in multicentric studies, then networking, collaborations, and partnerships are critical. So this should be all part of, this is a checklist, because each one of them is a separate topic for discussion. Like project management, you can go on talking about for a couple of days. Sample size, power analysis, the statistical issues, it could be a separate topic for the workshop. The point I'm making is that when you write a proposal, please ensure that this checklist is looked into. It carries forward, third slide, implications. It should have implications also. When you write a proposal, that what is the utility of this research? Limitations, if any. Sometimes people are very, they feel that we should not write about it, but it is always better to be upfront. If there are any barriers, if there are any bottlenecks you are anticipating, if there are any challenges, you write them that you are anticipating these challenges. To be upfront, honest, and truthful is always helpful. Dissemination plan is important. Any proposal, you should have how you will disseminate the findings. Will you, of course, you will publish a journal article, you write that, you will publish art paper in some good peer reviewed journal. You might plan some conference presentation also. You can have departmental or institutional dissemination meeting. You can also have the dissemination meeting with the donors. You can separately organize a consultation depending on the kind of research that you are doing. Budget and justification is very important. Sometimes we feel that because we are writing to the donor agency, I tell you, they look at the budget, and whether this budget is appropriate or not can be looked at in not more than 5 minutes. Sometimes a small research project for which you really do not need so many things, but people need chalo likh lo, because donor agency might give us, you put the thing, this, that, and then you inflate the budget also, but that creates a bad impression. The budgetary provision is to conduct this particular research. And therefore, whatever is required in the context of this particular research should be explicitly and appropriately mentioned. And of course, with justification. Suppose you need 4 research associates, then you give proper justification about these many data to be collected, and therefore you need people to go to field or to hospital and all that stuff. Suppose you are asking for some instrument, some surgical or some equipment or instrument is required for conducting this research. You give a justification that this research, this instrument is not available in your hospital, but which is important for this particular research. So proper justification has to be given for whatever budget that we ask for. It may be a travel budget, it may be a HR budget, it may be institutional overheads also. There should be some policy. You cannot randomly say that we need 15% institutional overheads or 20% institutional overhead. Every institution should have, of the total budget, suppose the total is 70 lakhs is the cost of a project, then you say that 10% is the institutional overheads, that over and above of what is being built into the budget. And that should have institutional policy, because donor agency would ask you, where is the institutional policy for providing you institutional overheads? But of course, you may have a policy of 10%. But like some agencies, UNICEF say that we will provide you 7%. It is their policy. So you cannot budget more than that. But I tell you, NIH like agencies in the United States, they give up to 50% overheads to the US universities. European Commission is something which gives, European Commission gives quite significant overheads to even researchers to the developing countries, up to 30-40% of, suppose you are asking 100 rupees, so they will give you 140 rupees, so 40 rupees additionally as the overheads. So it depends upon the policies of the donor agency, the policies of institutions which are securing grants for research work. Then you need, of course, ethics and IRB clearance, institutional support and commitment letter, because tomorrow the financial management system and other resources are to be required, and therefore dean or a director's letter is important. Study tool, questionnaire, instrument, and then obviously references, annexures, and there has to be executive summary. And the word limit for the executive summary is already generally spelled out. Maybe it's 500 words or 1000 words, not more than generally 1000 words, but it is somewhere around 300, 400 to 1000, 1200 words is the executive summary that should capture, because everybody would first read your executive summary. Nobody would read your 30, 40, 50 page proposal. They would first read it at executive summary. So executive summary should be able to create impression and arouse interest, that the person who would be reviewing your proposal should be able to look into the details. Now let's move on to, after having deliberated on the checklist that you need to look at, where are the resources and sources of the funding? And as I mentioned to you, and in the second slide that I presented to you, I said to you that there are more than 10,000 public programs supporting globally funding for undertaking research in different areas. But obviously, we all know that there are some national sources and some international sources that one can look at it. Government agencies, departments, and institutions. And when Professor Darvi was mentioning, he mentioned about like Ministry of Health and Family Welfare. Then ICMR is a part of the Ministry of Health and Family Welfare, but separate Department of Health Research. Then Department of Science and Technology, Department of Biotechnology. Then he also mentioned about CSR. These are Council for Scientific and Industrial Research. He also mentioned about the Science and Engineering Research Board. So these are all government agencies, departments, institutions that they would provide funding. Then there are UN agencies like World Health Organization, UNFPA, Then United Nations Food Program is also there, and even Red Cross and other agencies. So there are UN agencies who, UNDP is one of the agencies that is providing support to the health related issues. Then you have bilateral agencies who can support the funding for purposes. Then some philanthropic trust like Tata Trust is, one of the wonderful examples. They are supporting a lot of initiatives in India. Then foundations are there. Bill and Melinda Gates Foundation has a lot of investments in developing countries, including India. But Rockefeller Foundation is there, Thrasher Foundation is there, Ford Foundations are there. So there are many foundations globally that are supporting some of the research initiatives. Then the NGOs are there. The NGO sector is also important, and if they wanted to do something, they also consult researchers, and sometimes these NGOs are supported with the big grants, and they outsource some of the activities where you can chip in. So that kind of resource is also available. Then for profit companies, I think this is a very recent development, and you should note this, that initially research was seen as either the business of public institutions like government agencies, department institutions supporting, or then some philanthropic organizations and some UN organizations. But these days there's non-profit companies are there. People have created these companies, and they bid for big projects. And big means like country level projects basically. Suppose some implementation across the country in all the states or something like that. And then what happens is that they bid it on their own capacity, and then they look for specific aspects of, because that those proposals are very big proposals. Like World Bank, suppose health systems development project. Now it's a World Bank project, it's a big huge crores of rupees, of 600 crores, 1000 crores, something like that. And then but there are multiple pieces within that, and they look for the academic institution, research institutions, to help them in implementation of some of the aspects of those proposals. So for-profit companies, we are very closely working with minimum 3 to 4 for-profit companies, where they are supporting some of the research activities. In fact, one of the e-learning program currently we are developing, and which is completely funded by this profit company, as a part of their one of the capacity building initiative. Then of course the pharmaceuticals and this CSR funding is fortunately available, and because of this COVID, this has been diverted to COVID-19 activities. But by and large, a lot of CSR funding is available. Consulting firms are there. Now, these all PricewaterhouseCoopers and the Boston Consulting Firm and McKinsey, and these all management consulting firm these days working very closely, and they have entered into the health sector. Initially, their participation and presence in health sector was very limited. But now these days, I have seen, in fact, some of them are supporting some initiatives of the Niti Aayog and the Ministry of Health and Family Welfare. Even this COVID-19 pandemic, we had seen that they are actively involved in some of the work that they have been doing with the core government agencies. But of course, how would they do that? They would depend on us. They would consult us, and then if we have, so they also outsource some funding, and that's there. So contract research organizations are there, professional associations are there, Association of Schools of Public Health. I think it is still one funding which was they are providing to academic and research institutions, was till recently available, small amount, $10,000 or something like that, but for designing some innovations in teaching in the context of public health or community medicine. And I think that call was just closed, or might be closing also, I don't know, but it was in this week only. So last one, so this is ASPH funding, so they are also supporting. Then academic and research institutions and organizations, like for example, Indian Council of Medical Research is a research organization, obviously, but other academic and research institutions, they also get big funding, and then probably outsource some funding, and where you can chip in into. But what I will do is that, because instead of listing those, I will give examples from where we have obtained funding. These are the 3-4 slides, and I wanted to run through these slides. Wanted to mention that from all these organizations, I have personally involved in procuring. My institution has got money from all of them, like Q2 Asia, European Commission, then Pfizer. Now I just mentioned pharmaceutical company. I talked about UNICEF, Intra Health International, WHO Geneva, then Ministry of Health and Family Welfare, Government of India, then this MCH Star, then this United Nations World Food Program, an Australian International Health Institute, then OSED is there, then some state governments also. We have recently completed 2 projects for government of Madhya Pradesh. Then this APAC VHS is there. Then International Atomic Energy Agency, we got some funding. Then UNICEF India, of course, is one of the agency that we obtained funding. Then the TERI University, Wellcome Trust, ICMR, then WHO India office, because they have, see, WHO India office, they have separate funding. WHO CRO office, they have separate funding. WHO headquarters is separate. And even if you are, we did some work with other WHO regions also. And there you can get funding also. We work with the government of Maldives, where CDC has funded those initiatives. Oak Foundation. I mentioned the example of China Medical Board. Then United Nations World Food Program. Then USAID is there. Save the Children, US. Save the Children, India is also there. Then some state government like Ministry of Health and Family Welfare, Government of Mizoram. I mentioned about Bill and Melinda Gates Foundation, NRHM Haryana, or UNICEF Bihar. Because again, UNICEF, you have a UNICEF in Delhi. So that's a separate funding. But you can have UNICEF in Odisha or Maharashtra or Bihar. And so they have also resources available. So you can get funding from them also directly. Then DST, Government of India, then Ministry of Health and Family Welfare, NRHM, then Ministry of Health Maldives. Like we worked with some countries in the region. So the government of Maldives, we prepared their pandemic preparedness plan, and they had supported, so the World Health Organization, CRO region, TIDES Foundation. I mentioned few foundations, so this is there. Then this is CSR funding from Metals and Minerals Trading Corporation, MMTC. Then this major evaluation is a big program based in University of North Carolina, supported by USAID. Has supported at least, I think, around 5 projects of us so far. Then State Trading Corporation of India, India HIV/AIDS Alliance, then American Jewish World Service, Share India, the CDRF WTP fellowships, then SERP through PHRI. Then you have HCL Foundation, this Harvard School of Public Health, Micronutrient Initiative, John Snow India, then Indian Academy of Pediatrics, Aga Khan Foundation, Save the Children India. The earlier slide I was US. Then UNICEF Uttar Pradesh, the Incline program, then Tata Education and Development Trust, ICMR. McKinsey gave us some funding for doing some activity. Then Wellcome Trust, TBT Alliance, Deepak Foundation is an NGO working in Gujarat, the Infosys Foundation. Then we work closely with some universities, like for example, University of Toronto, then International Center for Research on Women, JSW Foundation, Palladium International, World Health Organization, EMRO region. As I said to you, that headquarter, then CRO, then India office, but this is the EMRO region that we worked with them on getting some funding. Then this Tamil Nadu Health Systems project was there. Then this RFDI is there, then Global Fund, then PATH is there, the World Bank, the University of Aberdeen. Like some universities, they have funding and they wanted to work in India. So we work with University of Aberdeen, then we London School, then even with the University of Sydney, then the Socio-Economic Research Division of the Planning Commission that time, basically. Now it changed to the Niti Aayog, but Niti Aayog also has supported the World Bank. GAIN is one of the organization, then NIH, the Fogarty International Center. Then this is Atal Bihari Vajpayee Institute of Good Governance and Policy Analysis in Madhya Pradesh. Then ILO is one of the agency that we closely work with. ILO supported some work in Sri Lanka also, and we recently completed some work in Maldives. Then University of Newcastle, Makrita Foundation, UNFPA, Oxfam, Rockefeller Foundation, then state-specific Government of Odisha funding, then this Norwegian Agency for International Development, then Housing and Environment Department of Government of Madhya Pradesh, Ministry of Chemical and Fertilizers. We have colleagues working in the area of the pharmacodynamics and pharmacoeconomics, and they very closely work with the Ministry of Chemical Fertilizers, Government of India, which are supporting. Then IDRC is there, DFID is there, FHI 360, George Mason University, then MRC, London, UK, then DFID, then Indian Council for Social Science Research, then this small project, but with Indian Public Health Association, they partly funded, then UN World Food Program, UNFPA, then Government of Odisha, Norwegian International Partnership, European Commission, Ayush Ministry. Just wanted to list, these are all agencies that we have procured the funding. And we have worked with these agencies over a period of time, and they are available. So these are the resources. So the initially I mentioned about the list of major like UN organizations or philanthropic organizations or variety of the agencies or NGO sector, and now this provided the menu of these are all organizations from where we have procured the funding, and they have their own websites, their RFPs and RFAs displayed for which they are looking for. But what they are looking for, all these agencies where they wanted to support you, what they need a good proposal to fund, and they would certainly look at the scientific merit and feasibility. That's the first thing that you would look at. And generally these are the 5 areas the proposals are scored into, 5-6 areas. One is significance, whether they would look for relevance and health impact in terms of implications, approach that you have used, the innovation, the track record of investigators, and the ecosystem that you have, environment like facilities, resources, collaborations. So these are the 5 areas that generally would look at. But you remember that there is a competition. Whenever you say that the huge amount of resources are available, but there is always a competition available, and you have to compete between them. In other words, what they look for is the proposal worth doing? Is it doable? Is the investigator and institution of capable of doing? These questions are discussed. Recently, I was sitting on you might be knowing this Nehru Fulbright Fellowship Program. And I'm on the selection panel, and we were reviewing the proposals of the candidates. And these were the very typical questions that were asked. Is this doable, or is it worth doing? ये करना भी चाहिए. Is it useful? Secondly, कर सकते हैं. Is it doable? And secondly, whether this proposal submitted by a particular researcher or institution, will he or she be able to do that? So that is important. The quantum of appropriate funding, as I mentioned, necessary safeguards are important, like ethics safeguards and other issues are important. But when you talk about sources of funding, this is also important to mention. Sometimes people feel that, are you then involved into a donors driven agenda? Because we may have our own priority matrix. And I'm sure that several of you might be aware that Indian Council of Medical Research had undertaken their own prioritization work in the context of child health, maternal health, infectious diseases, that their divisions are working around what are our priorities in the context of child health? What are our priorities, research priorities, I mean, in the context of suppose infectious diseases? So we have to see our national priorities and then align them with the donor agency, because it should not be donors driven agenda, that because they wanted to do something and then we are doing that. We have to also see that what we wanted to do in our own institutional interest and in the interest of our own population, our own people, and our own country. Because then I remember I had participated long back in, actually, I think I remember 2002, yes, 2002, 2003, in Mexico City, there was a conference and about basically the scientific, focusing mostly on the resources for science-based research. And the theme of that conference was that, are we dancing to the tunes of funding agencies? Like, because somebody is saying that we have money to do this, we have to be choosy on that, and we have to see our national interest are protected and important. What are the common problems, like new grant seekers, that if you are writing for first time the grant, ignorance about the agencies, that who would give the money? This is the question that is generally posed to me by many people, that I'm doing this work and then who would give money to us? So ignorance about agencies, ignorance about the procedure, know-how, how do you do that? Sometimes or exuberance that resulting into a proposal which probably is not manageable. Sometimes inexperience, because as I said that this is very difficult paradox here, that the funding agency wanted to invest in the people who are competent, but who are the new people who wanted to develop the competence probably by engaging into the research. So there, how you build your capacity is that, suppose there is a PI who is a senior person who has a standing in the field, you work as a part of the team, as a team member. And then you work on 3 proposals where you may be a co-investigator, but you build your own capacity. And then next time when you apply independently, probably you would get that money. Then poor peer review publication record. Suppose you have not been publishing, then chances are less. Not strong CV. Sometimes, very unfortunate. I have seen sometimes people have reasonably good curriculum vitae. They have good research credentials, but unfortunately, people don't know how to present themselves also. So this is also way that you know how to create your CV, how to present your research credentials into a CV so that they are impressive is important. And of course, inadequate research designs. These are the common problems that new grant seekers would take. Common reasons for rejection: does not fit into the funding agency. Like Tide is an organization which I know they only support research in tuberculosis, and you submit a proposal related to suppose coronary artery disease, so they would just say that this is not fitting into their funding priorities. Problem may not be important. Sometimes we submit something which we feel is relevant and important, but from the national perspective, from the agency perspective, from the public health or the research perspective, the problem may not be important. The study may not likely to produce useful and relevant information. Sometimes repetitive research, which I mentioned earlier, study is not focused, methods are not appropriately done, unrealistic situation, then poorly written proposals, unethical research proposal, then way of creating docket for grants documents. The way you are creating that document and sending it to the donor agency, the way you are presenting your whole docket, which might contain your proposal, your CV, and other documents, is also, these are small things which would reflect as a professionalism and are relevant and important. So the grant seeking process involves first as preparing a concept paper and get the feedback from the people. Like you write on 2-page document where you look for, suppose you are looking for a grant, then you create that 2-page document, circulate to your team members, and even peer review would be useful. Then learn the agency culture. Suppose you wanted to write to the Gates Foundation, you wanted to write to WHO or UNICEF, you understand that culture, and that also happens over a period of time. It never happens overnight. Then times of grants applications is important, because what kind of grants? Sometimes there are RFPs, sometimes contracts are there, sometimes consultancies are there. So you have to understand where do you fit into. Then you read submission guidelines very carefully. I don't know whether how many of you have seen the submission guidelines of NIH and some other agencies. They are around 80 pages or so, that you have to, but you have to read those guidelines very carefully. Although it is an 80-page document, it might take 2 days or 3 days to carefully read the document of submission of the document, but submission guidelines are important. And of course, after having submitted a proposal, be prepared for consequences. What happens at the end of the donor agency? Generally, they do in-house evaluation. And if they find that the proposal is useful, then and then only they would send it to the peer review purpose. If they find that the proposal is just not worth doing, they will close there only. Next step is the external evaluation. They have peer reviewers and they have reviewers in different thematic areas to work into, and they look at from the content and methods point of view. Generally, the blinding is done. Generally, the names of the investigators and agencies, the institutions who have submitted the proposal are not disclosed. That the blinding is most of the organizations it is followed. But when the decision is taken at a later stage, so blinding, because they have to look at the credibility of researcher. Initially, from content and methods point of view, it can be blinding. But if you wanted to see that whether this proposal can be done by these researchers or not, then the blinding is not possible. They have their own scoring systems and evaluation sheets. I tell you, some are so rigorous that I was involved in this Fulbright Nehru Fellowship Program. And, as a reviewer or sitting on the other side of the table itself, it consumes a huge amount of time to read those proposals and create those scoring systems and evaluation sheets. But it is our job. But the point I'm making is that it is a very rigorous process that generally followed. Once the proposal is submitted, and if it is accepted, it is the party time that you cheer up and then you're very happy about it. Sometimes they would ask you questions, and there is a possibility that you can revise the proposal and resubmit it. At times our proposals are not accepted and they are rejected and then comes back. But please remember, being rejected is not a waste of time. You have worked on a proposal, and if you see a value in that proposal, you can always reorganize that proposal and resubmit it to some other agency. Gains out of the rejected proposal is always a learning experience that you would have. And don't be discouraged. Persistence always pay off. I tell you, in these days also, after having worked in this particular area for sometimes we have to rework on the proposal, and our proposals are rejected. And so it's not that even very high class, good quality researchers' proposals would also be discouraged. Be prepared to revise and resubmit your proposal, and do not make a research proposal a one-time deal. Okay, I have developed it, I have submitted it, now it has not worked, and so it will be fine. Please remember, this is the last slide that I have for you. Unless you buy a ticket, you never win a lottery. The true fatal mistake is not writing a proposal. And remember, you may win. So it's not that something that you would, unless do it, you will not be able to relate it to. So that was something which I thought would share with you. But before I open up, I wanted to greatly thank rather actually Professor Darvi and Dr. Swati Mahajan and the academic leadership of the university. But because of the limited time, I touched some of the issues, because we generally do a 1 week workshop on grants writing, where we do hands-on experience. We ask people to come to us, and then they develop the proposal in those 7 days or so, because that's the hands-on training that is possible. But in limited time, I think this was possible, so which I could do. I hope that I have done justice, but I would be happy to respond to questions. So over to you, sir, for this grateful opportunity to me. Thank you so much.
Thank you, Dr. Gorpe, sir, for a wonderful session, very elaborative session. And many of the doubts of our PhD students, the postgraduate students, even the faculty members, overall, we all are enlightened by this particular in-depth lecture. I have heard number of lectures on this particular topic, but this lecture, standing ovation, otherwise in the hall if we are there. So thank you very much. Thank you.
Thank you.
Yes, Swati Mahajan, madam.
Sir, yes, million thanks, sir. It was really wonderful talk by you. I can say, like, you are a living database of funding agencies. So it's always said that what is in the name. But I think when research grants are concerned, it's everything is in the name. Of course, one has to gain that name with the efforts that you have put. So really, it was wonderful, and it was so comprehensive. Although the time was less, you have touched almost every aspect of the research grant writing or exploring the different research agencies. May I now request Dalvi sir whether we should proceed with the...
What I think, madam,
yes,
if there are any answers
yes,
are there from
yes,
the
sir.
audience, we should take those particular questions. Otherwise, we can conclude, because already it is...
Yes, sir. That's why I thought. So,
if there are any questions...
One thing I wanted to mention, sir, Professor Devi and Dr. Swati, I wanted to mention is that, sir, we work in the space of public health. And one of the important lessons that we learned in public health is that everything should be in public domain. So whenever I conduct any session, presentation that I share, I generally encourage organizers to share with everybody, and they should use it. What I will do is that I email my presentation to Dr. Swati and you, sir, and you can share with all the participants who joined today. That will be helpful to them, because not all the things could be remembered. So it is always useful that can be shared, because knowledge is there for sharing, basically. So I would be grateful if you can do that.
That is very grateful of you, sir. I think there are no questions in the chat box. Mainly,
there are appreciations in the chat box from number of our faculty members.
Definitely.
Yeah, and Savitharam madam, you want to say something?
So actually, I cannot say a word, because I was so impressed and I was watching him speak and unfold so easily. And it was a really wonderful lecture for especially our postgraduate and faculty, because there's always they are fumbling about how to do funding, how to get funding. And he so blatantly told us that how we should go to the agencies and how we should present ourselves. And I have taken screenshots of his presentation, which I will put up in the research department, those 4 boxes and 2 slides of his. So Dr. Zodpe, you were amazing. Thank you so much for being a part
Hello.
of our today's program, sir.
Sir, we have two hands raised. So should I unmute them?
Please,
Probably they want to ask the questions.
Sachin Kale.
Hello.
Yes, please go ahead.
Yeah, good evening, everybody. It was good evening, everybody. This is Dr. Sachin Kale, Professor of Pathology from MJ Medical College, Aurangabad.
Yeah.
I'm grateful for this particular session by our university, and I'm grateful to the speaker also. Sir, just one query. You have listed nearly 50 funding agencies. Can we sort of have some idea about the projects that they have already funded so that we have some idea regarding whether our topic fits their particular sort of taste or whatever areas of interest that are there, one. And secondly, is there particular sort of a time period within a year or a particular season during which these research grants are sort of given out? These were the two questions, sir.
Thank you, Dr. Sachin. These are very important questions. And I would say that because, see, we work in the space of public health and community medicine. So my engagement mostly is in that area. So, and our institution is also a public health institution. So most of our projects were related to research in the context of public health. But public health is such broad, actually. I tell you, we do a lot of work in, like I just mentioned, obstetric fistula or pelvic inflammatory disease, or now the predictors of COVID-19, which could fit into internal medicine also, So therefore, broadly, these agencies provide support to a lot of medical research also. And medical research includes even diagnostics for that matter, or clinical research that would be support. But predominantly the research that I'm personally involved because of my engagement is related to the public health. And the second aspect, the second question you asked is what?
Is there a particular season during the year?
Yeah, got it. They have the cycles basically. Like for example, every agency either have a yearly cycle or 6-monthly cycle, and they invite proposal, because I know NIH for that matter, they generally announce 2 times in a year. But it also depends the kind of a work, like UNICEF, WHO. What they do is that if they wanted to the year long on the website, you can have a watch on them, and then they have the section on their websites where they would put the RFPs, like research for funding proposals that are invited to. So it is variable from agency to agency. Some of them have cycles, like every 6 months that they would announce. Some of them, when they have questions in mind, they would say that they wanted to do it. So at any point in time that they would put it into there. Some of them, once you are, like, for example, now, WHO health systems, once you work in the health systems division of WHO, then whenever they have a research, they have a list of the researchers, and they will circulate it to all of them. So that kind of approach. So whenever they announce anything, they will circulate to all the researchers that they have earlier worked with. So you get those notifications about the grants also.
Okay, sir. Okay, sir. I guess we need to check their websites and keep track of the things that are announced there, I guess. Thank you so much, sir. Thank you.
Thank you, Dr. Kai. Thank you.
Sir, is there any such database of funding agencies?
Not specific database basically, but like, for example, we created our own internal database, like the one I have presented, because we worked more than with 100 agencies basically. These are the agencies that I personally worked, but some of my colleagues work. So as an organization at Public Health Foundation of India, we have, like, for example, around 200 agencies or more than that. And then we have the contact details and everything, because we have the research and development cell, they maintain everything. So those kind of institutional databases are there, which are created. But some databases, like in some NIH works with some agencies, some UN organizations with some agencies. So they have created their own databases also.
Okay, sir.
So
Okay. Preeti Padvi, madam. Preeti Padvi, if you want to ask anything. Okay. Any other question?
Good evening, sir. Harshad here.
Yeah.
Sir, any particular agency which is funding for TB elimination program, any operational research related to TB?
One is the program itself, basically. RNTCP has a funding for operational research, and
Yeah,
I was a part of that committee also. So that's there. Then FIND is the organization. You might have heard also FIND.
yes, sir.
So FIND is the organization which supports that. Then even the Gates Foundation has a priority area identified as TB program. So there are certain organizations which exclusively work in TB, and they would support funding. Gates Foundation is very keen to support some of the initiatives in the context of multi-drug resistance tuberculosis, and even the Clinton Foundation. Then CDC is there, is keen to support. When the program shift has happened to the daily regime, then the CDC had supported our work. They requested us to work in 6 states to identify the bottlenecks and barriers if the strategy change happens into the context of the program. So these are the agencies which support the TB research.
Okay, sir. I have been in touch with all those agencies, but the problem is that they have 6-monthly cycle and quarterly cycle. So it is under their review. Any particular agency which is accepting proposals all the year round?
I don't recollect year round, in particularly in tuberculosis, but 3 months, 6 months is not a big deal basically, because once you submit a proposal, otherwise 2 to 3 months would take to, generally most of the agents, of course, see what happens is that suppose there are some agencies which work with the program, RNTCP as a program, and in the program review meeting, suppose in RNTCP program review meeting, they identify these are the important bottlenecks from the program point of view or some research area which needs to be resolved as quickly as possible. Then Global Fund, which is supporting our RNTCP program, you might have heard about the Global Fund.
Yes,
so the
sir.
Global Fund then through the ministry only, but it is again operated through the ministry only. They would put on the ministry website that these are the areas that they need quick answers and the proposals are invited for. But then that is again program driven. If the program feels, the RNTCP committee which is reviewing the program, they feel that ye karna chahiye jaldi. So the one that I mentioned to you about supported by CDC, when there was a shift in daily regime that 2-3 years back that has happened, they put a proposal and then we wrote the proposal and we got the funding. So that then happens ad hoc basis.
Okay, sir. Thank you.
Dr. Sadhana Kulkarni ma'am has one question, I think. Dr. Sadhana Kulkarni ma'am. Sir, she has the question here in question and answer session. Like most of the agencies support RCTs, randomized controlled trials, and not observational studies. Like how to solve this problem? Like she's from anesthesia department.
No, clinical trials, of course, are important because they are the best designs, and research that is generated through clinical trials is more acceptable because they're very robust design. But there are agencies which support observational studies also. I can say in the context of public health, we do a lot of research. The sero surveillance that currently we are carrying out is an observational research. And, it's not intervention research basically. So that is supported by Indian Council of Medical Research. But in the field of anesthesia particularly, I may not be knowing, in somebody supporting observational research, but I believe that there must be agencies which would be interested in supporting observational research.
Rajini madam has one question. Yes, ma'am.
Hello, good evening. Good evening, Dr. Zhorpe. And I think this was an excellent presentation where you presented both the rigor and the rewards of fund seeking proposal process. Now, the question that we have is that we are in this process of applying for research funding jointly with a global organization which works for spine care. And they would be applying this to the Skoll Foundation. Now, this would be a study because it would be done in the area of public health and at primary healthcare level. The question is that when we work with these funding agencies, particularly the international funding agencies, does the government of India have any regulations regarding the data sharing, or is that completely governed by the institute where the proposal is presented for the ethics? Because in your organization, you would be working day in and out with all these funding agencies, largely which are international.
I would say that there are three things when you work with outside agency. One is that, of course, when we receive funding for research that is to be carried out in India, then we have this FCRA clearance is important, number one. Number
Right,
two is
and we are facing a challenge over there, being a private institute, but the institute is working hard towards it. Our Vice Chancellor, sir, is leading this process, and hopefully we should be able to secure that soon.
That's one. Second is there is the HMSC clearance, the Health Ministry Steering Committee. When you are doing research with the external agency, then now initially ICMR and now the Department of Health Research, because now ICMR is the Department of Health Research, they have a Health Ministry Screening Committee. That HMSC clearance is important. And as a part of HMSC clearance, basically, whenever any data, which is a sensitive data, particularly like genetic mapping of populations or something like that, is to be shared outside India, then that needs to be, the concurrence has to be obtained, and that HMSC clearance has to be obtained as a part of the data sharing currently. But I'm also aware that ICMR is currently working for, because that is related to the genetic material, biological specimens, and the government is very conscious about that. But I'm aware that Indian Council of Medical Research is also now working around a broader policy for the data sharing outside India.
Right, right. And so the last question is, does the National Rural Health Mission also guide in this process? Because particularly if it's at the community level?
Yeah, it's like basically they would not get into research, processes and the data sharing policy on that. They will not. They will say that you take from HMSC, because HMSC is the national body basically. If you have HMSC clearance, NHM or any other organization, any other agency will not bother you too much on that.
Right, right. And so when you work with such international funding organizations, and if NRHM is also a partner organization with an institute, I mean, do you see that kind of partnership working well? Because then you have kept in the loop the National Rural Health Mission also. I mean, what would be your guidance?
Sometimes you need a support letter also. Suppose you are working in the context of health and wellness centers.
Right, right.
Then NHM is involved. So the support letter from NHM will add value to that, in fact, or a primary healthcare or any other project. So multi-sectoral and multi-stakeholder engagement is always plus for any grants proposal.
Right, right. Certainly, sir. Thank you so very much. And this is very, very meaningful and highly informative. Thank you.
Thank you.
Thank you.
So, in the conclusion, I will say that this is the excellent academic feast and much needed feast and academic inputs to all our PhD students as well as postgraduate students, also to the faculty members enthusiastic. And what Dr. Zodpe sir have said, there are certain institutes which are research-driven institute or research in the new national education policy. Also, they are categorizing the universities as research universities only. So, incline and that particular name, the MGMIHS should achieve, and such inputs will surely go a long way, because as you have mentioned, that is not the one-day affair, a long effort that is required by all the faculty members, all the students, all the PhD scholars, also the postgraduate students, and then that day will come. So in that, this particular input, academic input, will be the one of the important milestone today that you have given to us. So on behalf of all, thank you very much, sir. Thank you. Thank you. Thank you all. You can...
Thank you.
Thank you very much.
We can conclude here. Swati madam, you want to say?
Yes. So just one thing I just want to say.
Yeah.
I think for developing this skill of writing for the grants, and so I think attending the 7 days workshop with sir at Public Health Foundation of India, that will be best for us. And I will request you, sir, to sponsor few of us to go for that workshop.
Surely. We will discuss this issue. Surely, there is no issue.
So that is one request to you, sir.
Really, the faculty is interested. We will surely explore.
Definitely, sir, and definitely that will add to our skills once we develop a research proposal there.
Yes.
So thank you very much once again, sir. Thanks on the behalf of MGM IHS. I thank our Vice Chancellor, Dr. Shashank Dalvi, sir, for supporting us for this workshop. I also thank Dr. Sabita Ram, ma'am, who is Director of
Thank you.
Research Scale of MGM IHS. And I'm immensely grateful to Dr. Sanjay Zodpe, sir, for sparing his precious time for this webinar. And lastly, I thank all the participants for patiently listening. Sir, I assure you that definitely help us. This will help us to go to write, at least begin with writing for the research grants. So I can say a journey of 1,000 miles begins with a single step. So definitely, I assure all from the university that will definitely take this step to go ahead in this area of research grants. Again, thanks you once again. Thanks a lot. Thank you.
Thank you.
Thank you, Swati. Thank you, Swati. Thank you, Jodhpur. Bye.